the most common question that I get asked is, how do I interpret my testosterone blood results? It's never easy because you can't just give a simple answer based on a blood result. It's always in the context of the clinical picture. The easiest result to interpret is if you've got somebody who is not on testosterone and who has symptoms suggested that they might be low in testosterone, and you do a testosterone result and the result is undetectable. That's the easiest situation to interpret. You know that that person has got a very low testosterone or absent testosterone, and you can start testosterone replacement accordingly. Where it becomes a bit trickier is if somebody has a result that is reported as normal, and bear in mind that sometimes an undetectable testosterone is reported as normal because it is normal for postmenopausal women to have no testosterone. It's not abnormal, but it doesn't mean that it's not low testosterone that is contributing to symptoms. But if you have a testosterone result that is reported as normal and it is detectable, that's where it can be called into question, because women run different testosterone levels, and so what is low and causing symptoms in one woman might be completely normal and not causing low symptoms in another woman. And that's where we just lack so much data and so much clinical experience, and why it's important to have your results interpreted in the light of your situation and the clinical picture. So having a result that is within the normal range does not mean that you are not eligible for testosterone replacement. The other situation that we see quite commonly is women who are using testosterone replacement and they have their testosterone levels taken and their result has come back as high. The automatic response is sometimes just to reduce it because people panic about over-replacing. They should absolutely be cautious about over-replacing, but we often see what we call artefact or untrue or unreal blood results showing testosterone levels. If after you've had your testosterone blood result taken that there is any chance of contamination, so for example, if there's any chance that you've got your testosterone cream or testosterone gel in the area that your blood's been taken from, or did you apply it that morning and then have your blood test taken straight away? All of those things can put your result up artificially. So if you are not experiencing side effects, then the most important thing to do is nothing and just repeat that test and see whether it really is true or not. We like women to have normal female physiological testosterone levels because we don't want to run the risk of irreversible side effects if someone's running a testosterone that is too high. The problem with that is that every lab is different and every normal range is different. And that's why it's really important to discuss your result with your doctor to determine whether or not your result is normal for you. It is never a question of that's too high, that's too low, because it's always a question of what's going on in the clinical picture. Is this result real? What are your symptoms? Have you got side effects? And then you take it from there.